So historically, we know that renal cell carcinoma is considered as one of the most radioresistant malignancies, and the role of conventional radiotherapy has been controversial in this setting. But with the development of new techniques such as stereotactic body radiation therapy, or in short, we say SBRT, has been shown to overcome the radioresistance of the renal cell carcinoma tumor cells. And recent studies show that the use of SBRT in oligoprogressive disease is considered to be safe, correlates with improved outcomes such as increased progression-free survival, local control rate, and extends the systemic therapy duration. And now in our routine clinical practice, when we see a patient with oligoprogressive disease in the current systemic treatment, rather than changing the treatment, we offer patients radiation therapy with SBRT. Understanding the characteristics of patients who respond to radiotherapy will help us in clinical setting to define which treatment is working the best and what is the timing. And maybe in the future, by looking at these biomarkers, we can identify some new novel treatments that can target and decrease this radioresistance and help with the radiotherapy treatment. Currently, it's still under exploration. There are not many data regarding the biomarkers for SBRT in oligoprogressive disease. First, we included patients who developed oligoprogression during systemic treatment and received SBRT for the oligoprogressive disease. Then we looked at the patients, their duration of systemic treatment before and after the radiation therapy. Those patients who had increased duration following the radiotherapy were defined as having greater benefit. And further, we looked at their genomic and transcriptomic profile to identify if there's a biomarker between the greater and lesser benefit groups for us to identify. We saw that patients with lesser benefit had enrichment in pathways related to reactive oxygen species, which consists of genes related to antioxidant systems. And one of the main cytotoxicity mechanisms of radiation is through the development of the reactive oxygen species and then DNA damage. Thus, we think that overrepresentation of these antioxidant systems might contribute to the radioresistance that we see. And on the contrary, when we look at the greater benefit arm, we saw that there is a high expression in the pathways related to cell proliferation and cell development. Cells are more susceptible to radiation damage during the G2 and M cell cycle phases. Thus, we think that this might have been the reason that these patients responded relatively better compared to the lesser benefit arm. The next step that we would like to do, definitely we need a larger cohort. Right now we are limited in sample size, and if we have a larger cohort, we will be able to understand what biomarkers are actually playing role in the benefit. So the next step is looking for collaborators who have data sets with patients with SBRT treatment. And also there are a couple prospective studies as well that will be very nice to look into their data to see if there's a correlation to confirm our findings in a way.